All right, good morning, everyone. Several of us have hard stops right at 11 today, so we're going to go ahead and get started. So I'd like to thank you all for joining us this morning, and welcome to the Driving Innovation with Healthcare, Driving Innovation in Healthcare with Location Intelligence webinar. My name is Robbie Deming, and I work on the media team at Esri. This webinar is actually the final installment of the Health Information Technology webinar series that we've been running over the past few months. You've all joined the webinar in listen-only mode, which means your microphones are muted for the duration of the webinar. That said, we absolutely still want to hear from you and encourage you to submit questions into the chat at any point during the webinar. We will have a live Q&A at the end of today's session with time permitting, and we'll do our best to address any submitted questions. This session is being recorded and will be sent to you shortly. We'll share a survey at the end where you can provide your feedback on this session. If you can spare a few minutes, we would really appreciate your perspective. Here's a quick rundown of today's webinar. Dr. Este Geraghty will kick things off with a few comments before Matt Myers discusses improving your competitive advantage with location intelligence. Ana Lòpez-De Fede from the Institute for Families and Society at the University of South Carolina and Dr. Karen Hansberger from IEHP will share their respective stories before participating in a short panel discussion and Q&A with Georgie Tucker. With that, I'd like to go ahead and hand things off to Dr. Geraghty to get us started. So slight change of plans, everyone. Sorry about that. So next up, we're going to have Matt Myers from Esri, who's going to talk a little bit about how you can use location intelligence to improve your competitive advantage.
All right, great. Well, good morning, good afternoon, and welcome. My name is Matt Myers. I'm an account executive on the Health and Human Services team here at Esri. Today, I'd like to show you how you can leverage location intelligence to make more accurate decisions with your healthcare organization's capital investments, align your services offered with local health needs, and really focus your marketing efforts for the greatest impact and ultimately gain the competitive advantage. The focus of this presentation is market development and strategic planning, or really how healthcare organizations can grow their market share, expand into underserved markets, better support their existing patient base, and in the long term, reach new patient populations to ensure that that steady growth for your organization. At Esri, we're very firm believers in leveraging geography and kind of the science of where to achieve these initiatives. So the level of analysis, it all begins with answering the fundamental questions of where. So where are my organization's problems? Where are those problems changing? Where should we locate a new resource? If you listen closely, you'll come to realize that people are always talking about location in one way or another. So where's an incredibly powerful concept that can produce some very fruitful results when leveraged properly. And geography really acts as a glue for kind of bringing your data sets all together, being able to analyze them and visualize them, and ultimately be able to start detecting patterns. And this really then allows you and your organization to drive informed action. So today I want to briefly walk through some workflows that I think are essential to your work in market development. So Esri will help you to add a geospatial component to your overall business strategy. You can begin to evaluate your existing network locations to figure out maybe why some locations perform better than others. You can better understand your patients, where they live, and how to find new patients in your service areas. You can easily analyze markets to determine, which ones are best for expansion. And our technology is deployable in, desktop format, web, mobile, and can also be deployed in an enterprise infrastructure on your existing IT environment, where you can then analyze protected information like, protected health information in a HIPAA-compliant environment. But before I get there, I know that most people want to know about the data itself. So the question of where we source our data is always one of the first questions asked. We collect and distribute global data from 137 countries and have an expert team of demographers and statisticians that help us curate the data, which spans, categories ranging from demographic variables, business information, consumer spending data, traffic counts, and crime indices. There are over 15,000 variables in all, and Esri's data sources have really been acclaimed for accuracy and been ranked #1 when compared in blind studies against some of the 4 other major data vendors. Now, beyond the Esri curated data, you'll certainly want to use your own system data in your analysis. As extract, transform, and load, or ETL methods are, readily available within Esri technology. You can really set up your own configured workflows so that your data, whether it's, coming from an electronic health record system, billing system, staff system, or a population health management platform, it can very easily be connected at the source and leveraged in your analysis. So Esri, provides kind of a laundry list of tools that will help with not only pulling in data from inside your organization, but also crowdsourcing data from outside your organization as well. So, as an example, we've set up digital surveying tools, for example, that have been used to kind of digitize housing and urban development's mandated point in time counts for the counting of the homeless population, and also, providing a streamlined way for tax-exempt health systems to conduct and digitize their community health needs assessments. The ArcGIS Living Atlas of the World is a Esri curated and also user curated data collection. It's actually the foremost collection of geographic information system in the world, or geographic information in the world. It's curated, by a mass community of users. Contains, maps, data layers, tools, services, and applications for geographic analysis that you can add to your existing data and applications to create beautiful maps, imagery, and visualizations of your analysis. And location, plays a critical role in your health. You'll commonly hear, especially from the Health and Human Services team here at Esri, that your zip code is oftentimes a better predictor of health outcomes than your genetic code. For those not familiar with Tapestry segmentation data, this is Esri's lifestyle segmentation system, which is used to classify every neighborhood in the United States. And Tapestry combines some really powerful demographics data with consumer and media behaviors so that you can customize both message and medium to a particular neighborhood. So our workflows that I wanted to show you today that are designed kind of around strategic planning and market development are really composed of 4 main components. Those are data, maps, analytical workflows, and reports and infographics. So let's look at some of the ways we can start to visualize our data and begin to better understand our markets. So whether you're, looking to expand your market share or, better understand your competition, it really all starts with asking where. So for example, where are your facilities today? Just providing that really basic level of context can give you immediate insights. You can start to see kind of what's nearby and hypothesize about how features like, water bodies, road networks, or terrain may impact your existing system. You may even find that maybe some of your facilities are too close together and maybe potentially, cannibalizing your own business. Next, you may want to compare, your locations to your competitors in the region. So are they so close that they may be the cause of your leakage issues or lost revenue? Or perhaps you're looking to move into, an untapped market that's currently being underserved. Just having this understanding provides a foundation to dive deeper into asking more finely tuned questions. Next, you'll want to review where your patients are coming from. While it may seem simple to understand the locations of your facilities and patients, I'm sure you realize that variations on these questions can get directly to your bottom line, helping you to calculate your market share as a portion of the overall market potential. So the screenshot included here, we're looking at this individual health system's patient density displayed as a heat map. So geography makes it very easy to define your service area in any way you want to. You may want to look at your patient density for a facility and break down your service area by zip code. Or maybe you want to take a look at where the nearest 50% or 75% of your patient-defined service areas lay. Just given this level of insight allows for you to better understand, which parts of your network are most critical and potentially where a patient population is being underserved. Or perhaps by accessibility. So in this example, these outlines show drive time accessibilities at 15, 30, and 45-minute intervals. So you can see, just how far patients are willing to travel to take advantage of your services. This is also really a foundational component of determining network adequacy requirements that the Center for Medicare and Medicaid Services requires from those health systems that are also health plans. Next, as you're planning your smart growth strategy, you'll want to predict where your patients will be in the future. So that will really depend on understanding demographic trends and population shifts, as well as changes in the health status of your patients and the population at large. You'll be able to understand the market outlook in a way that really directly supports your opportunity to grow and fill service gaps. And with easily configured pop-ups that can be integrated into your maps, you can explore more information about areas of particular interest. Just in this block group, for example, we can see current and predicted populations, expected growth rates, and growth trends over the last 20 years. Well, it's one thing to be able to visualize your data, but we want to, use that information to make better decisions, like where a potential new site for a new ambulatory care center or just a general expansion of your care network would have the greatest impact. And once we've gone through the effort of identifying our current locations, identifying our competition, our patient base, and how the location or local population has changed over time, we can start to couple that data together to identify specific areas where our new expansion areas will have the greatest return on investment and also impact on patient well-being. In doing so, we can look at our site selection areas, as in the provided example, and identify surrounding attributes like local crime rates to better understand how safe our patients will be at this new location. Or maybe we want to explore and look at transportation accessibility to see our proposed new location and see how accessible that location would be to public transit. We can further hone down our analysis and site selection by analyzing tapestry segmentation of the surrounding area. If you recall, I'd mentioned tapestry segmentation to understand intimate characteristics of the patient population we plan to serve, like, what is the median household income? What are the spending habits or expected health insurance statistics or preference of outreach, to make sure that we're reaching your organization's services and messaging to its intended audience. And once you've performed your analysis, you can use one of the dozens of pre-configured, infographics, or customize, your own with your organization's branding and messaging to share your work both internally and externally. You can configure the look and feel of these infographics. You can export them as an image or an interactive HTML, and customize them to really display exactly the information that you want, displayed in the way that you feel is most easily understood by your audience. In summary, when you're able to kind of couple geospatial data together with critical workflows, you're able to glean an immense amount of advanced analytical insight that will give you guys the advantage over your competition. I want to thank you guys for the opportunity to speak, and now I'll pass it over to Anna from the Institute for Families and Society at the University of South Carolina. Thank you.
Thanks so much, Matt. As you said, I'd now like to introduce Ana Lòpez-De Fede, who is a research professor and director at the Institute for Families and Society at the University of South Carolina. Ana, whenever you're ready, go right ahead.
Thank you for this opportunity, and welcome everyone. I really want to highlight some of the wonderful things that Matt talked about in the presentation that I will share with you. My name is Ana Lopez.
Can I interrupt you just briefly? I'm sorry. Can you put it in presentation mode?
Absolutely.
Sorry about that.
No, not at all. Thank you.
Thank you.
I had it on presenter mode, which had me looking at two different screens. So not a problem. Thank you for that cue. So as I was saying, I really want to thank Matt for that wonderful introduction to some of the work that we are been a part of for the last 25 years. My background is in health services research, and as I lead a research team of interdisciplinary individuals at the University of South Carolina, we have a core GIS group that is larger than most other academic research units. And that is, we have the privilege of working with the Medicaid agency and having the ability to geocode, do an exact location with multiple characteristics of the Medicaid population. So roughly 1.2 million individuals who Medicaid serves through a variety of different services. And my work is underneath the Institute for Families and Society, and I lead an interdisciplinary team of roughly 40 faculty members, research associates, graduate students, and additional individuals. My focus is on better birth and maternal outcomes, which is one of our projects. And as you can see those arrows and those connections, it really is about anything that we do, translating it and having the ability to have individuals look at those interconnections between quality, care coordination, and then specifically with the Medicaid population, Medicaid reform. And so as we walk through that, one of the key things that we're always interested in doing is making that connection between health and place. And so we look at and report on a variety of different metrics, as many health departments do. And we add on some additional layers that allow us to understand those connections between poor health outcomes, poor birth outcomes, long distance to perinatal hospitals, that notion that Matt was talking about around access. And then on top of that, we are able to add on the issue of being able to look at high needs areas, that health and place connection. And so what you see here is the hotspot analysis, red being poor, blue being areas in which there are better outcomes, and that intersection in terms of the highest quartile between percent of preterm births, low birth weight, and less than adequate prenatal care, layer on top of the disadvantage index that looks at a variety of social determinants of health. And so as you can see, this provides some important information that then allow us to drill down to those areas where we see that there are more than three or more high need conditions with high births that coincide within those hotspot areas. Looking at birth outcomes and understanding the Medicaid population, it's also important, as I mentioned, for us to add this social determinants of health component. At the end of the day, one of the values that we have found in our research is that the ability to translate complex statistical analysis into visual tools, maps specifically, that allow the driving of the discussions. And so in this particular case, we're talking about data that is available through Esri and multiple other sources. We're looking at percent of without high school diploma, percent unemployed, below poverty, food stamps, and mobile homes. So this ring map concept allows us to look at various different determinants, measures of health, at the same time that we're looking at a base map of South Carolina across 4 tertiles that is allowing us to look at higher needs areas, shaded. And so you can see that I can look at a county, identify where we have high social determinants of health and high Medicaid involvement. And that begins a dialogue around partnerships and other areas for intervention. one of the things that we do is we launched a project in South Carolina to increase lactation services through the certification of baby-friendly hospitals. And as you can see here, what we've got in the base map are the percent of deliveries that in which lactation services were being utilized. Those are shaded in blue. The yellow areas indicate where no lactation services have taken place. And then those hashtag areas are places where we've had less than 15 deliveries. The key component here is that it's also wonderful as a visual evaluation tools as discussions have taken place with why is it important for a hospital to undergo that baby-friendly designation. And so you can see that just the addition of 3 hospitals has increased substantially. And when we look at some statistical analysis, we see that the encounters for care and examination of lactating mothers has increased from roughly 2% in 2016 to a little over 6% in 2018, really indicating that the higher baby-friendly penetration rates are also associated with higher breastfeeding initiation rates. Once again, I'm showing you this ring map concept because it's something that we have found to be incredibly effective in terms of looking at multiple associations or intersections. The 2 outer rings are contraceptive methods. The inner rings go back to the issues of social determinants, evaluation characteristics, single mothers, education and poverty. That base map is the percent of women of childbearing age enrolled in Medicaid. So once again, what we can see with this area on the map is, especially those areas outlined in red, is that the higher percentage of single mothers, women living in poverty, and women with less education had less access to contraceptive services. The ability to target, the ability to form partnerships with other providers within those geographical areas has made for more fruitful discussions among the key stakeholders that frame the South Carolina Birth Outcomes Initiative. We've also taken all of that information and put it into an individualized hospital portal, and you can see on the top that it really identifies data partners. All of the data associated with birth outcomes, maternal and newborn are there. And then there are a series of visual maps that identify access to delivery sites, partnerships, as well as when there are hospital mergers, and sadly, when hospitals leave our rural areas and its impact on access. Different audiences, different content, different perspectives. And so this is a very good example of how we infuse our mapping products in order to highlight the content, even when it is a flyer or a place card, or some of the other things that we are distributing to stakeholders across the legislature, state agency directors, as well as hospital individuals and community stakeholders and consumers as well. Let me end by saying, and I love this quote because I really think it highlights everything that Matt talked about, and that is that for us, and the reason as researchers we have embraced GIS technology, is that maps are the workbench on which ideas are fashioned in a manner that permits them to be argued and often tested. And so I have found as an academic researcher that my statistical analysis and my ability to talk about statistical significance oftentimes is not as powerful as my ability to display it, to show it, to engage them in conversation. And so GIS has become one of the most important tools in my toolbox, in our toolbox, as we talk about improvement of maternal and child health outcomes and birth outcomes in South Carolina. Thank you very much for the opportunity to share this work with you.
Thanks so much, Anna. It's really inspiring to see the improvements and changes your work has driven. Now we're going to go ahead and hand things off to Dr. Karen Hansberger, who is the Chief Medical Officer of IEHP.
Okay, well, good morning and thank you. We're so honored to be able to present our emergency preparedness web application that we developed here at IEHP to help better take care of our members. Just a quick overview, IEHP is a not-for-profit mostly predominantly Medi-Cal health plan. We have some Medicare that is Medi-Medi, and we are headquartered in the Inland Empire, which is in Rancho, our physical place is Rancho Cucamonga. We cover roughly a fourth of our population, which is 1.25 million members. And the Inland Empire covers over 27,000 square miles, which includes a very diverse geographic area, which is high desert, low desert, mountains, and then urban and suburban areas. So this project started because of the devastating wildfires in Northern California that were sparked by power lines that were broken in high winds. And all of the California utility companies, seeing their risk, took the position of turning off power in these high wind scenarios. Unfortunately, the Inland Empire is frequently affected by high winds, especially during our fire season due to our Santa Anas. So the question quickly became, how do we take care of our members who require equipment that is electrically based? And so our team developed this program so that we could, in our GIS, so that we could actually quickly locate our members that are affected by the power shutoff, and our teams could then start coordinating both our utilization management teams as well as our case management teams coordinate to be able to take care of those very vulnerable members. Durable medical equipment are things like ventilators, oxygen concentrators, electric wheelchairs, electric hospital beds. And it tells us those members are incredibly ill, as well as the fact that their mobility may be significantly curtailed. And so being able to move in and help them and to assist them and augment their plans is very important. I'd like to take credit for this. My only idea was that, hey, can we map out where our DME patients are? And our team came up with this amazing program that we'll run through now that I'm really very proud of. So if you first look at, when you get onto the GIS portal, we can see our area, and outlined are our hospitals as well as our ancillary providers, which are our dialysis units, our skilled nursing facilities, and our CBAS centers. CBAS centers are like adult daycare. If I go up to the hyperlink, the Southern California Edison shutoffs, that takes us directly to their website that then tells us which areas they will be shutting off for at least part of the day. And when you go over to the Southern California Edison little icon here, you can then pull down the affected area, and those areas are already determined, and we have them all put into the system, and that comes up as an area on our map. So the next, we take all of our own personal information we have at the health plan of members that have received, and this one is for all durable medical equipment that are in that area. And then we can go from there. Our teams can take that information and download it into a file that has all of the member information to be able to contact those members. We can always also sort for the different types of durable medical equipment that we're looking for. So ventilators only, or perhaps hospital beds. So a perfect example of why this is important is that the normal process would be for a member that needed or help or was on a ventilator to call 911, and the 911 operator would send transport and they would be taken directly to a hospital. This situation is urgent but not emergent once the power goes off, because most important DME has battery backup for a certain amount of hours. And so it does allow our team time to find appropriate placement and to arrange transportation to facilities other than hospitals, since hospitals are usually already highly impacted by a crisis of this nature. So we also applied this to areas of fire. And with the San Bernardino Mountains, we are sadly on the national news every other year or so because of our fires that are taking place here. And so the same process can be also taken down to where the burn areas are, as well as where the evacuation areas are in our geographic area. It also provides us the ability, again, to coordinate care for our members, but also to look for our providers that might be affected and facilities that may be affected that need to have evacuation. So we go back to our map, and this time we go to the hyperlink that says California fire incidents and the little fire icon here in the corner. And that brings down our ability. Now this one, because these areas are not predetermined like the Southern California Edison circuits are, we have to draw this map onto our map from the website that we see with CAL FIRE. And then once that map has been created, then we have that fire boundary in place. We can then go and look at what our membership is in that area, and all the members that are in that area are seen. All of these can be then taken and sent off to our marketing department and communications, where they can send out text messages telling members that they are in an evacuation zone. They can also link them to information on what's important to take with you when you evacuate your home. We can also look at, again, our DME and narrow this down to a smaller group, and who do we need to help evacuate out of their homes. So for example, if you have a hospital bed, usually that means that you are bedbound or close to it and might have difficulty being able to get out of your home, and our teams would be able to either coordinate with EMS, or if it's emergency, or to provide other types of transportation to be able to get you safely out of the area. We can also identify providers that are in the area by changing our query to provider. And then we see that in this area, there are 5 providers in that area. And then we can link to a provider, and that gives us all the information, phone numbers, faxes, to be able to coordinate and talk to them and see what we could do to possibly help them. So I want to give you a real life scenario that happened last summer when we were affected by not only high winds, but wildfires. And one of our skilled nursing facilities had to be evacuated because of its close proximity to the wildfires. So here we see our fire area that was identified, and this skilled nursing facility that was then identified in the area that needed to be evacuated. The information on this skilled nursing facility told us that we had 14 members that were in that skilled nursing facility that we needed to be able to work to transfer out. We also could see other skilled nursing facilities around that facility and be able to reach out to them to look for beds, to make sure that we could provide care for these members and avoid them going into the hospital. So I'm happy to answer any questions that you might have.
Thanks so much, Karen. So now what I'd like to do is I'd like to go ahead and bring Anna back, and I'd like to introduce my colleague, Georgie Tucker. So what we're going to do now is have a quick panel discussion between Anna, Georgie, and Dr. Hansberger. And if there's time at the end, we'll go ahead and still take questions from the audience.
Perfect. Thank you, Robbie. So we just saw 2 really incredible uses of location intelligence in the healthcare setting, both looking at different issues. And my first question is for the presentation we just saw, Dr. Karen Hansberger. And from that presentation, it was really clear that a geographical approach really helped IEHP mobilize quickly in such a disastrous emergency affecting so many individuals. 1.2 or plus million members of IEHP in the local area. And these California fire seasons are just devastating. And my question is, as a chief medical officer, you're looking at things from an operational standpoint, a high level view. And, what was the biggest takeaway from this critical emergency response effort that was implemented pretty rapidly within IEHP to keep your members safe?
I think the biggest learning that we had was that the power of the tool and the ease of use for the users. So the power of it is more than actually I anticipated when I initially asked them to do this, that we could take so much information that we had, and sometimes health plans, we have almost too much information. It's hard to be able to get it into a functional unit. But by putting it into this map and making it geographically significant, we narrowed it down so quickly. And anyone can use this map, which is the best part about it, is that my case management department or my utilization management department, who doesn't know anything about GIS, can go in and work this and be able to pull down these queries in just seconds and be able to then start intervening for our members. So it's really a powerful tool. The only thing we have yet to do is to figure out some way to really get it connected directly to our EOCs at our counties. But I'm really excited about the potential of this, to use it for other areas as well.
So I guess that brings me into, so this tool is able to be utilized across the board in terms of ease of use. But then I imagine, I mean, fire season is not just a one and done thing. We're going to experience fire season and disasters pretty shortly here in Southern California. And so looking at it from an emergency preparedness lens, do you view this type of application, or looking at things with a geographic focus, being applicable towards future disasters or future crises, like what we're facing in the world today with COVID, actually?
Yeah, absolutely. So this can be applied to anything that we do. If we needed to take other bits of data besides DME, if we wanted to use areas that perhaps if there was unrest, or if we had a flood, which we don't get very often here, sadly, that we have the opposite problem. But if we had anything else, that those areas could be mapped out, and we would be able to figure out who was in those areas and how we could outreach to them in a very short period of time. And our texting program to let people know that they're in danger, all of that can be utilized. So it's really just a beginning of tapping this resource and figuring out its real power.
Absolutely. Well, thank you so much for sharing that with us. I'm sure it was valuable to all of the listeners in looking at a disaster response approach. And now, Anna, something you said really resonated with me, and it was evident through your slides that when researchers are able to take what they've learned through the data and translate it into practice, involving the data and the outcomes of the data to really drive policy and kind of steer the direction of the service interventions. And so taking that data analysis and really applying it, you have access at the university to so many very valuable data sets, and not a lot of, I mean, we have the data, but putting it to use. Seeing that much data over such a long time, what trends or challenges specifically to health or barriers to health equity do you see as recurring themes? And if you do see themes, how do you envision location intelligence supporting these challenges, like moving down into the future? I think you're muted. Real quick. I still can't hear you. It might just be me though.
Can you hear me?
Yep, there we go.
Perfect. There you go.
Excellent. Sorry. Thank you for that question. And so for me, one of the really powerful connections to GIS is the ability to understand the social determinants of health. And for the last 25 years, we have been using this technology to really make some key points. So let me give you a very quick example. The reason I became involved with GIS technology is I was asked to investigate poor maternal and child health outcomes in a neighborhood surrounding one of our academic research centers, one of our academic medical centers. And they were indicating some of the poorest outcomes. It wasn't access. They were clearly within walking distance to this academic medical center. The issue was a long-standing history of isolation due to race and the perception of this community in terms of the reception and the welcome feeling that they had related to the hospital. And so for many of them, they found that they did not feel comfortable. They did not feel that their social economic, their minority status, racial and ethnic backgrounds were welcoming in terms of this new facility that was built. And so I began to question, what does that mean? Why? It's within walking distance. And so it led us to really looking at the pinpointing the neighborhoods with some of the poorest outcomes associated with some of these issues. And so it was very clear to me that my data gave me some wonderful information regarding birth and maternal outcomes, but it didn't tell me very much about the community. And I have found subsequently throughout the years that it's critically important for us to understand that health and place connection in order to really drive services, look at partnerships, look at stakeholders. And I think the example of it is our current understanding of COVID-19. What are we finding? We're finding that this intelligence software, the ability to look at that health and place connection, really are the drivers to understanding the spread, understanding the needs where we need to be more proactive. And so I fully believe that it is this kind of intervention that will help us address some of the disparities, some of the issues in which we see intergenerational, and we see communities that are continuously ranking among the poorest outcomes. So if we're going to change health systems, or we're going to change health, we really must begin to understand its context within the places that people live.
Absolutely. And it's not just a one view of health. It needs to be a holistic view of health where you take in the social and economic factors, and they vary geographically. So that's incredibly important when looking at health disparities or gaps in health equality. I'm curious, what started your journey into GIS? Did it just come naturally as a researcher, or how did that begin? What did that look like?
For me, I was originally trained as a psychologist and then moved into health policy, health services research. And so my own particular background was always one of looking at issues much more holistically than my own individual training, as well as being in an institute that was framed around interdisciplinary researchers. And so for me, I was a faculty member in family medicine with a psychology background and a health services research policy background. And so that really lent for a very unusual kind of intersection roughly 20 years ago, the exploration of these common themes and the way that my own worldview and understanding in terms of being across those disciplines.
Wow, that's fascinating. That really is taking a holistic approach, because your background comes from so many different areas of expertise. And so I just wanted to say thank you both for sharing your stories, for sharing your work with us. And it's just so fascinating to me. I was a nurse for 12 years and coming into GIS, and it's so fascinating how GIS can be applied in so many different avenues of health, whether you're looking at maternal child disparities, whether you're looking at emergency preparedness. I mean, every avenue is different. It just reminds me of nursing. I mean, you could be a neonatal ICU nurse, or you could be a geriatric nurse. It spans the whole gamut of what's possible, and it's really it opens up your imagination to what's possible, and it gives me hope. And so thank you for the important work that both of you guys are doing within your institutions and organizations. And I think I want to hear from people on the webinar. If we have any questions, Robbie, I think now would be a great time to take some of those.
Thanks so much, Georgie. We actually didn't have any questions come in during this one.
Oh,
So
interesting.
I think both of you and Matt just did an excellent job, and it was super clear. So thanks so much to both of you.
Thank you for the opportunity to be a part of this.
Absolutely.
Yes, thank you so much. This was fun.
All right. Well, I'd like to thank Anna, Dr. Hansberger, Georgie, Matt, and Este, all of you for joining us today. Once you leave today's webinar, you will receive a survey on the presentation, and we would appreciate it if you would complete that and provide your feedback. You will also receive a follow-up email within 24 to 48 hours with a link to view a recording of today's webinar. On behalf of Esri and our presenters, thank you all for joining us today, and have a great rest of your day. Thanks so much.